conference will now be recorded.
Hello. Yeah, am I audible to all of you? Yes, write down in the chat box if I'm audible. We can start with the session. Okay, yes. Hello and welcome to Rayz Mrcog, the introductory session for part 1. So currently, when you hear about Mrcog, this is the thing that what comes into mind. Like how we are supposed to go there, how far is it? You don't have much idea. You're not sure what you're giving the exam, how is it, and where is it going to lead us, and what are the benefits. So discussing all these points and why are we here today is to get to know about Mrcog exam. So Mrcog means it's going to be the member of Royal College of Obstetricians and Gynecologists. It is a global exam, as we all know. So here I am, Dr. Rashmi Patil, the Director and Chief Mentor for the Rayz Academy, and I begin the Rayz Mrcog Part 1 Introduction. This should be the state for most of us when we think about giving another exam. But we look into this. It's one of the gold standard exam, and it is recognized in most of the countries. So we can think about giving this exam and adding it to our the CV. So it comes in 3 parts. Part 1 and 2, these are online from the Pearson centers at present. So part 3, currently it is online right from our home. So because of the pandemic situation, they have made it as a virtual exam. So it's conducted online right from the home for the part 3 now. To begin with, what we are supposed to do, we are supposed to log in the Mrcog website and create an Mrcog account. So we get a college number. This number is specific, and for future referral or the future use, we are supposed to use this college number. So first step, what we are going to do is the creation of the Mrcog account. I think most of us have already done this, and we have filled that eligibility form. So once we have filled the eligibility form, it takes around 4 weeks for the processing time after submission. So we have to wait for them to accept that. So this is the main website where we are going to get all our information, whatever our doubts are there, we are going to get in this website. So we have to go through the Mrcog global exam. If you click for the part 1 Mrcog, this page opens up, and what all relevant information we require about part 1 exam, it is over here. So this is the website for all the 3 parts. We are going to get all the materials also over here. Okay, so currently the July exam will be conducted on Monday, 4 July 2022. The expression of interest is over, and the part 1 eligibility deadline is over. So we are here at this step waiting for accept of expression of the interest when it is going to close by 9th March. So whoever is going to show the interest, please submit that form. It is going to get accepted. So show your expression of interest before 9th March. So we are at this step right now. Once you're showing this, the booking tokens will be sent to the candidates to the registered mail ID where they have entered in while creating an account. You will get the booking token at that mail. Then the window opens, the booking window opens on Wednesday, the 30th March. Once the booking token window is open, the same time you're going to log in, you're going to book your slot. Once your booking slot is done, the candidates will be contacted by the Pearson centers to book their center. So that will be by 27th April. So we are at this particular stage now, and I'll be guiding in the group how to go ahead with the further process. So 3 stages to booking process. One is expression of interest. So you have to do that before 9th of March. And booking into a country location, you have to go there. You are getting a booking token. You're going to receive that, open that booking token on that particular date, and then go and book a country location there and the place. And booking into the Pearson centers, they will contact you through the mail, and you are supposed to book your particular place of choice. Currently, as of now, for fees for 2022 Part 1 exam fees, what has been displayed in the website is the pounds 508 for the UK and Republic of Ireland, and there are certain bands like ABC. So we are supposed to look into which country do we belong from that particular band and then pay the amount accordingly. Now, July 22 Part 1 exam, here the expression of interest deadline shown is Wednesday, 9th March. What are the requirements? You will receive the token, as I said. A booking token does not guarantee a place on the exam. Remember that. So once you have received the token, it doesn't mean that your seat is booked. It is just the token. You have to click on that. So candidates who receive the booking token, they will have an opportunity to book a place in the exam when the booking window opens. So it does not merely mean that you have got a seat in the exam. It means you have got an opportunity to book a place in the exam. So please open that booking token on that particular booking day, and then you are supposed to choose that. So it is the candidate's responsibility to ensure that their college account number, the email address provided in this form, they are correct. Am I audible to others? Just so you can open up your mic and say if I'm audible. Okay, so you are supposed to open that link. It is not a confirmatory seat that you have got. You have got an opportunity to book your place. So open that link and make sure your college account number, the email address, everything they are provided, and it matches with your personal RCOG account information. And then there should be no two thoughts. So the same details have to be given there. Otherwise, if it does not meet this requirement, you may not be eligible to receive a booking token at all. Okay, for example, there are a lot of syllabus topics which are there. So in brief, if we are going to tell, this assesses the scientific platform like cell function, human structure, measurement manipulation, illness and all. So if you look into, there are two papers. These are the subjects that are being divided. However, there should not be a clear-cut boundary, but these are the expected subjects which will be covered in the part 1, that is anatomy, biochemistry, embryology, endocrinology, epidemiology and statistics, genetics and physiology in the first paper. In the second paper, biophysics, clinical management, this is very important, data interpretation is very important, immunology, microbiology, pathology and pharmacology. So am I not audible to others? Apeksha, can you hear me?
Yes, ma'am, I can hear you.
Yeah, Shilpa, just check at your end, dear, if there is some network issue. Okay, so these two parts are there. There should not be a clear-cut demarcation, but these are the first papers and the second paper topics. Now you look into this. So endocrinology, this is very important over here. Anatomy is very important. Then physiology is important. So these three topics are very important. Then the pharmacology is there. The clinical management point. So nowadays, most of them, the pathology. So most of the questions are being framed where a clinical scenarios also can be given. Speaking about the knowledge area, clinical skills as in patterns of symptoms, understanding the risk factors and all, pathological basis for physical science and clinical investigations, how to interpret the results and the clinical investigations. In the teaching and research, so you are going to get the principles of screening, clinical trial design. So these will be covered by the biostatistician also. Levels of the evidence, quantification of the risk, then safe prescribing, quality control. These topics are going to be covered in that. The core surgical skill, that is demonstrate an understanding of the issues and surrounding the informed consents, how you have to take them, and with the surgical procedures and knowledge about the basic surgical procedures in obstetrics and gynecology, including the diagnostic laparoscopy and simple procedures and complicated ones too. Then knowing the principles and the procedures involved in more complex gynecological surgeries, good knowledge of safety of the surgery, and principles of surgical team working, risk management, and risk reduction. These are very important clinical governance topics. Antenatal care topics like maternal anatomy, endocrine and physiology, patho, screening test, abnormalities, fetal physiology that we are looking into, the placenta problems, inheritance, ultrasound findings, interpretation of these data, and social deprivation, the pregnancy outcomes, all these we are going to discuss. Then epidemiology and pathological processes that underlie the common maternal diseases, for example, in the maternal medicine module, the pathophysiology and presentation of the common infections also, and the drugs which are used to treat the maternal disease and the potential maternal and fetal complications too. Imaging methods used to screen the maternal and fetal complications, for example, the ultrasound, X-rays, MRIs, and how to interpret these results. Management of labor, this is very important. Physiology, biochemistry, and endocrine related to that. Tocolysis and stimulation of uterine contractions, the principles, the fetal physiology in the late pregnancy, assessments, and the placentation and the implications could be there. Delivery related, the mechanism and physiology of childbirth and third stage, etiology and pathology of congenital and bone malformations, the mode of action of the drugs which are used in the labor, delivery, and the third stage, the indications for and risk of operative deliveries, and the biochemical basis of acid-base balance, the female perineum, and the principles underlying the management of perineal repair. Postpartum, yes, we all know the physiology and the structural changes are there in the neonate, and the physiology of lactation, which is very important, the uterine involution, patho and management of the puerperal sepsis and infection, the common puerperal problems, including the mental health issue. This is a major concern, and postpartum contraceptions and drugs which are used in the postpartum and during lactation. Speaking about gynec, the anat physio and the histopath, the epidemiology, micro, and the therapeutics of the benign gynec conditions, including the infections, how to interpret the results, which are commonly performed investigations for benign gynae conditions, principles of medical and surgical management, we are going to cover them. Subfertility, example, the anat development, functions of cell biology. These could be of male and female reproductive tracts or in the context of their relevance to the fertility and disorders. How to interpret these results and investigation in commonly performed investigations of subfertility. In sexual and reproductive health, we get the physio, endocrine, epidemiology, and the pharmacology of contraception too. And the STIs, the termination of pregnancy, the Fraser's competence, we'll be dealing with all these, and surgical management and drugs and the medical terminations. All the clinical governance points will be dealt along with this. The early pregnancy care, for example, the basic science which are there, etiology and histopath of miscarriage, ectopic trophoblastic disease, this is very important, and diagnostic features of the scan, and how to interpret these results, and which are used especially in the early pregnancy problems. These investigation we should be aware about. Speaking about oncology, the anatomy and of the abdomen and pelvis, the cellular biology of the cancer, the genetic origin of the cancer, principles of diagnosis and screening for these cancers. What is the pain pathway, the transmission of this pain, epidemiology and etiology of the cancers, the pathology and classifications, radiotherapy and chemotherapy. So what is the pattern of this exam right now? So part 1 consists of a computer-based test. Candidates must pass part 1 before taking the part 2. So this is understandable. There are 2 computer-based tests. Each consists of 100 single best answers. You do not have a negative marking here. They'll give you 4 or 5 options. You are supposed to choose one single best answer. Each paper counts for the same marks. So paper 1 counts for 50% of the overall mark. Paper 2 also counts for 50% of the overall mark. There is no minimum score required for each paper, and the outcome is determined only by a candidate's overall combined mark. So the timetable will be, single best answer is 2.5 hours, so 150 minutes, and you will have to solve 100 questions. You will get a lunch break between the 2 exams, approximately of 1 hour. And the second paper will also consist of 100 single best answers, 2.5 hours, that is 150 minutes. So this is the basic thing, how it is going to go. And we are going to run the course for July 2022. This will include all the live sessions. The session recordings will be uploaded. The course library access will be given. And important questions are going to be discussed at the end of each session. So we are going to start solving the questions in the group 2. So we have to solve the books and we have to solve the recalls from the previous exam. So the course is going to begin from the next week. The course will span over 15 weeks. So we'll be covering till the mid of May. And after that, in the June, we'll be having the crash course. What to study? So study smarter, not longer. So you are supposed to make an ideal ambience to study, learn an ideal learning state, like exactly what you're going to focus on, and specify what you want to achieve. Choose the study material and the courses carefully and identify the unfamiliar points and what exactly you need to focus upon. So we have to speak about the theory books, the web portal, the practice books, and the recalls. So theory books and the guidelines, basically, we are going to discuss. Few are standard ones. So this part one, this is from the RCOG course, the RCOG itself. So we need to know about this in and out. There are other revision books which are available. Oxford also is a very good book. So Oxford revision notes for the MRCG part one. We have Tim Chard, the basic science, and we also have Richa Saxena. Then obstetrics and gynecology books are there by the Bakers. In the web portal, the access will be given to the live session recordings, question pools, which will be arranged subject wise and the topic wise also. Will provide an image library where you have to look into the pictures and then you need to learn. Basically, this is going to help you for all the anatomies and the embryology, then most of the pathways, the cycles. So this is going to give you a pictorial image and basic guidelines and how you have to manage the algorithms. So all those things will be provided. Summaries, speaking about them, there are certain standard guidelines. These are called as the green top guidelines, which the RCOG frames. These are very important for throughout your MRCOG exam. The main points, the main questions, whatever you're going to discuss is through the standard RCOG website, and they have these guidelines freely available. So these guidelines, we are going to provide you all the summaries so that you don't have to go through the entire guideline. So the summaries will be provided to you. That is one. Plus, we would also suggest that reading the guideline once will also help you to understand the summary. In case if you just want to just give it a read, a quick read and then going through the summary will also help you. The next one will be the NICE guidelines. And these are the set which are again important. These two are very important for your part 2 exams too. So start for your preparation right now for the part 2 itself. So along with the part 1, you have to make your basics strong for the part 2 itself. There are certain other topics which will be provided. These are the journal articles called as TOG articles. So the obstetrics and gynecology, these are the standard RCOG journals which are released 4 times a year. So they come in volumes and they have the issues and articles. So these articles also we are going to provide you the summaries, the video recordings. So you can go through them also for the quick revision. But these are going to be important for you for your part 2. So only the important topics which are necessary for the part 1, we will ask you to go through those summaries or go through those articles. Remaining, we have to concentrate more on the basics in part 1. For clinical management, the data interpretation, we will require these guidelines, the summaries and the videos. So you can go through them. And towards the end, when it comes, so you will be having a mock exam. So you have to take that mock exam towards the close to your end of the course. So in between, we'll be giving you all the access to solve the questions. You can go the subject wise as well as the topic wise too. Now speaking about the practice books. In the course group, we will start solving the practice books. So I would encourage all of you candidates to choose one book and post at least like 10 questions per day to the subject that we are going to start from next week, so that your preparation starts from now itself. You understand the thing in depth. So what you're going to do is you are going to study the topic from the books, and then you're going to prepare these questions from the practice books. We'll help you through that. In the course group, we all mentors are there, so we'll help you through this. Once you start practicing these questions, if you have any doubt, do tag us. So we'll come and solve you those questions too. And keep 1 hour for at least recalls. This is very important. All the recalls, everything, I have shared it in the group. So 1 hour retrospectively, you have to start solving the recalls. 10 questions, 15 questions. So slowly you will start increasing the recalls numbers. So try spending 1 hour of recalls. How many ever you are able to solve, whatever doubts you get there, do posters and we are going to solve those recalls for you all. And if you get any doubts, please tag the mentors. We are there to help you. So we are going to study together and then we are going to succeed together in this. After this part one will be your part two exam. So we'll guide you through that too. Speaking about the schedule and the timetable, so from 14th of February, we are going to start this. First, we'll begin with the biochemistry, then pharmacology, patho, embryo, anat, 1 and 2, because it's a lengthier topic, micro, then the biophysics, genetics, physiology, endocrine will be divided into 2 parts, clinical management and data interpretation. So this is how it's going to go. And last one, we are going to have the biostatistics session. So this is how it's going to go. The course will be spanned over till mid of May. So this is me here, your chief mentor for the Rayz MRCOG Part 1. And Rayz Academy is my dream venture. It was launched last year. We'll be completing 1 year now. And lots of students have cleared from this academy. We started on with the part 3, then the part 2. Now we have started with the part 1 too. So we'll be there throughout the journey till you get your dream degree. So go for it, girls. So happy studying from the team Rayz Academy. So let's start the journey today. And thank you so much for attending the introductory session. Any doubts that you have? Hello?